Hi, I'm Dr. Cyrus Rangan. I'm a pediatrician and toxicologist with California Poison Control, and we're talking a little bit about holiday hazards. And I think when it comes to holiday hazards, we know that during the year we keep our medications out of reach of children, we keep our cleaning supplies locked up, and our detergents, etc. But when it comes to the holiday season, we have to be aware that we are often bringing in a number of hazards into our house that we may not be aware of. We bring a live tree into the house and we don't keep it watered, the tree can become brittle, that can become a fire hazard. The things that we would put on the tree, for example, the ornaments, the lights, the tinsel, all of these can be hazardous as well. They can break, they can become choking hazards, they can fall on the floor, become a hazard for an infant who's walking around, an infant who might be chewing on the electrical cord of the lights. In addition, some of the materials that we use to make the ornaments, for example, the glitter and the pigments that we use to paint them in the manufacturing process, some of these can contain hazardous chemicals such as lead, so we have to be aware of that too. We have multiple sources of lead in our environment, so the mantra is whatever sources that we can control, we should control. So if we know that potential sources of lead may exist in our environment, we try to make sure that kids are in as little contact with them as possible. So some of the items that we have around holiday time, like our painted ornaments, like the foil wrapping paper, even the little tiny batteries that are in some of the toys that we have. For example, the watch batteries that we find in little train toys, we call them button batteries. And those can contain toxic metals such as lead, even mercury, cadmium, nickel. So we have to watch out for these in a big way during holiday time. All of these metals have the potential to cause a multitude of problems, especially in young children. They can cause interferences with kidney development, brain development, and they can cause a number of other problems that can lead to permanent damage along the way. When parents bring candy into the house, they should make sure that the candies that they are buying are name brand candies from stores that they trust. We find more and more these days that candies that are imported or brought in from other countries such as Central America or Mexico or from overseas can contain toxic amounts of various contaminants. And one of the most common ones that we see contaminating these candies is lead. It's difficult for a parent to know just by looking at a child whether a child has been poisoned by something like lead. In general, children need to be exposed to lead for an extended period of time in order for symptoms to develop. So it can be a very silent poison in the early going. So if parents are concerned that they have a product that contains lead, or if they're concerned that their child may have been exposed to it, give us a call at Poison Control and we can tell you what to do next. If a parent needs to contact Poison Control, call 1-800-222-1222. That's a national number that you can use anywhere in the country, from any phone, 24 hours a day, 7 days a week, 365 days a year. And we have people available to answer calls in almost any language. So if you feel like you don't speak English well enough, you can certainly call Poison Control, ask to speak to an interpreter, and we can get your call in order. As a pediatric physician and toxicologist, I can say that lead poisoning is the #1 environmental poisoning concern amongst children nationwide. We have multiple sources of lead in our environment, and we get trace amounts of lead from the food that we eat, from the beverages that we drink, and from the air that we breathe. So the mantra is that we should always make sure, no matter what we do in our lives, to try to control the sources of lead that we can control. So if we know that a certain product may contain lead, try to keep it out of reach of children, try to make sure they don't handle it and put it in their mouths, and try to keep it out of the house as much as possible. When it comes to lead exposure, prevention is the best cure.